For children with type 1 diabetes, there are no foods that are considered off-limits. Your child will still be able to eat all of his or her favorite foods. Through the course of your stay, we will educate you on how to select the best foods for a healthy lifestyle. Rather than a structured meal plan, we will use a method called carbohydrate counting to monitor food intake at all meals and snacks. We will discuss this in detail later in the video. You will be visited by a registered dietitian during your stay in the hospital. They'll be available to answer any questions regarding the information presented in this video. There are 3 main nutrients that make up all of the food that we eat: proteins, fats, and carbohydrates. Of the 3 nutrients, carbohydrates cause blood sugar to raise the most. This is not a bad thing. Carbohydrates and the energy that they provide are important for growth. However, every time we eat or drink, we will count the grams of carbohydrates and provide enough insulin to cover these carbohydrates. If we eat foods and do not give insulin, your blood sugar can become very high, which can be very dangerous for our bodies. To know which foods have carbohydrates, think about breaking the foods into the 5 food groups: grains, vegetables, fruits, dairy always contain carbohydrates. Protein group usually does not have carbohydrates. Let's talk more about carbohydrate counting. There are a few ways to determine how many grams of carbohydrate are in the foods that we eat. Food labels are one way to know the grams of carbohydrate in our foods. When looking at a food label, it's important to look at 2 lines: serving size and total carbohydrates. Remember, if more than 1 serving is eaten, we must multiply the total carbohydrates based on the amount that was actually eaten. For example, if you eat 2 cups of cereal and the serving size listed on the package is 1 cup, we must multiply the total carbohydrates listed on the package by 2. Make sure you're using measuring cups and spoons or a food scale to accurately measure out your food. Do not rely on the eyeball method of measurement. Another method of looking up grams of carbohydrate in food is websites and phone apps. Calorie King and MyFitnessPal are 2 apps that provide carbohydrate information for generic foods, brand name foods, and restaurant foods. Both of these apps also have website versions. You can also use restaurant websites to look up specific food items. Lastly, there are many books that list nutrition facts for foods. Your dietitian will provide you with one of these books during your inpatient stay. This book is what you will use to look up foods that do not have a food label, whether it comes from a restaurant or homemade from someone's house. Remember, no matter what method you use to look up carbohydrates, be sure to pay close attention to serving size. Also, make sure you always measure out your food. Proteins and fats do not contain carbohydrates. Proteins like meat, fish, poultry, and soy, and fats like butter, oil, cream cheese, and sour cream are all considered carbohydrate-free and do not affect the amount of insulin needed. If you remember from earlier in the video, foods that contain carbohydrate include starchy foods like breads, pasta, crackers, rice, potatoes, beans, fruits, vegetables, milk, and yogurt. Also, while meats are carbohydrate-free, if they are breaded, they will contain carbohydrates. Remember, if you're ever unsure about whether or not a food contains carbohydrates, look it up. It's always better to be safe than sorry. Take a look at this meal: ham and cheese sandwich, apple, milk, and carrot sticks. Which of these foods would have carbohydrates? For this meal, it may be helpful to break it down. For the sandwich, we know that ham is a protein. The cheese is protein and fat. Therefore, we only need to look up the grams of carbohydrate for the bread. The carrot sticks have carbohydrates. Therefore, we would need to look up the bread from the sandwich, the apple, carrot sticks, and the milk. Remember, when in doubt, look it up. If you're confused about which foods are carbohydrate-free, it never hurts to double-check to make sure. How many carbohydrates can my child eat in a day? With type 1 diabetes, we recommend a healthy amount of carbohydrates that can be eaten at a meal or snack, since carbohydrates are important for growth and energy. However, it is important to have set meals and snacks, rather than grazing throughout the day. It is important that your child eat breakfast, lunch, and dinner with enough grams of carbohydrates to receive insulin. Snacks are not mandatory. However, if your child feels hungry or is experiencing low blood sugars between meals, snacks may be helpful. Remember, try to keep meals and snacks 2 to 3 hours apart. This will help keep blood sugar levels stable throughout the day. Now that we have discussed what foods you can eat, let's talk about drinks. Aside from treating a low blood sugar, all regular sweetened beverages must be changed to sugar-free. This includes sweet tea, sports drinks, lemonade, soda, juice, fruit punch, and Kool-Aid. However, these beverages in their sugar-free form are all okay. The best example of a drink option is water. Other examples of good beverage options are diet lemonade or tea sweetened with a sugar substitute, diet soda, Crystal Light, and sugar-free Kool-Aid. If you're unsure of whether a beverage is sugar-free, check the label. A sugar-free beverage will have 0 grams of sugar listed on the food label. Milk does have natural sugars and carbohydrates. Milk is also full of important nutrients. Therefore, we do not want to limit milk intake. However, drink milk at meals or snacks and include it in the total grams of carbohydrate for the entire meal. As we mentioned in the beginning of this video, you'll be visited by a registered dietitian during your stay in the hospital. They'll assist you with any specific questions or concerns regarding your child's diet. We encourage you to ask questions so that you can feel comfortable with the diet guidelines prior to discharge.